The American Red Cross is sounding the alarm about the country's blood supply. Last week, the organization declared a nationwide blood supply crisis for only the second time ever. While all blood types are needed, the agency had less than a one-day supply of type O positive blood, the most commonly used in trauma care. Joining us now with more on the potential impact and how hospitals can prepare are Dr. Konstantin Kanakis, the incoming medical director of Blood Bank and Transfusion Services at Northwestern Memorial Hospital, and Kellie O'Connell, the CEO of the American Red Cross of Illinois. Thanks to you both for joining us. Appreciate it.
Thanks for having me.
Kellie, the Red Cross announced this blood supply crisis last week. What is the latest update?
Yes, we still are in a crisis. We absolutely need more people to make appointments and come give blood. We're seeing some movement, which is fantastic, but over the summer, we often see the blood supply dip a little bit. This summer is a little bit more unusual because we're contending with lots of natural disasters across the country, even right here in Chicago and in Illinois, where we've seen an uptick in tornadoes and storms, right? And so that just disrupts people's everyday.
Who can donate?
Many people can donate. You just have to be 17 years old, weigh 110 pounds, and generally feel healthy when you wake up that day.
Okay. Dr. Kanakis, in addition to trauma care, what other blood service needs do hospitals have?
Well, that's a good question. Of course, it's easy to recognize that folks that experience trauma need blood, right? But those having surgery with some blood loss, pregnant women, premature babies, those with chronic anemias, and as the rates increase in the United States, those with chronic illnesses like complex leukemias, lymphomas, and other things.
Kellie, I noticed in the press release when you all made this announcement last week that you referred to something as sort of like the trauma summer, right? Like or needs increasing in the summer, in addition to what we're experiencing now where donations are falling.
Right. So most summers, traumas increase, right? You have different accidents. There's lots more activity out there, so we do see more accidents and more trauma going into the hospitals. We also see folks taking more vacations. Your routines are not the same, right? And so we see less and less people coming in to donate blood. So those two things, increase for need and decrease of folks donating, are sort of the perfect storm.
And of course, this summer you also have cyclosporiasis.
Yes, we do have that. We have many more natural disasters, as I talked about. We've had to cancel blood drives because of lost power due to storms, right? So we're trying to run as fast as we can to make sure we keep up with the demand.
Dr. Kanakis, tell us about the work that you've done in helping hospitals to prepare for blood shortages.
Sure. Having a plan or a policy about blood shortages is useless unless you actually practice it, right? So we've done research in doing simulation exercises and measuring local regional confidence in blood centers. And it turns out that those that do have a plan, as we studied, are more confident in dealing with them. They've got a plan to do it and they can respond accordingly. Plans include things like triaging who gets blood first if there's a limited supply, what to do when you change your policies when there are shortages, and bringing people that might not normally be in the decision-making process part of the table.
What are some of those ethical questions that the team will have to work through during a shortage?
Basically, at the crux is who gets blood first if everybody needs blood and there's not enough, right? So bringing in the ethical questions, specialists to deal with that, specialists in transfusion, specialists in blood supply, talking about the same sort of milieu of things that we have to consider for patients, all of which goes into philosophies that we employ, including things called patient blood management, where we try to use the fewest amount of blood products to achieve the greatest outcome, all while trying to maintain success and safety outcomes.
Kellie, why O-type? Why is that so necessary?
Well, the doctor can talk even more about this, but it really is that universal type, right? So that when there's a trauma, you know that can go to any patient. And so that's so important. And that's why we're really trying to get anyone who's type O in to donate blood this summer.
What can people expect when they go donate?
It's very easy. I actually became a blood donor for the first time when I joined the Red Cross. I was one of those people who was a little bit scared, but it takes less than an hour. You go in, they check your iron and do a quick health history to make sure you are able to donate, and the donation process itself can take between about 6 to 8 minutes.
Okay. Dr. Kanakis, long-term trends in blood availability, are there?
There are. Over the past few decades, the number of donors has decreased, especially for those under 40 years old. Under 30, it's really, really low. So trying to get those young donors back to the donor centers is critical. Additionally, what's important is making sure that the donor supply is as diverse as the recipient supply, which in a place like Chicago, we've got, you can imagine, a very diverse patient population.
Kellie, we talked about the sort of the historic nature of this particular crisis. The last time the Red Cross declared one of these was in 2022. What happened then?
Yep. So that, as we probably all remember, was during the COVID time, and it was when COVID spiked. And so we are seeing an increase in COVID. Folks were needing to stay home, and folks were being infected with COVID, and so weren't able to come out and donate at the same rates that we needed them to.
Okay. So I don't know. It's just a little interesting that the second ever to happen, the second crisis ever to happen, is happening now under some very different circumstances. We are not in a global pandemic.
True. No, that's true. I think there's just, again, there's a couple things going on with foodborne illnesses, the sort of summer routine changes, and then the natural disasters that are really happening all across the country.
Doctor, go ahead.
I was just going to say, the really good news, though, it's solvable, right? If folks can come out, even if 3 more people go to each drive that we have on the books, the crisis will be eliminated. We'll be able to have the blood that we need.
Doctor, we've got 30 seconds left. Why is it important to have a diverse supply of donors, or diverse donors?
Yeah. Traditionally, a lot of donors came from 1 or 2 demographics of folks, and there is, as you can imagine, many, many diverse genetic components in people's compatibility with blood, more than just ABO typing. So making sure the blood supply is diverse, make sure that we can safely take care of patients.
Okay, that is a good place to leave it. Dr. Constantine Kanakis, Kellie O'Connell, thanks to you both for joining us. Appreciate it.
Thank you for having me.
Thank you.